And promoting good health and wellness, that is the goal of a new initiative that SU is working on with the West Side Initiative. This morning we are joined with two guests all the way from No Jane Brothers Supermarket this morning. Tom Dennison, the director of the Lerner Center for Public Health at SU, and Paul No Jane from the supermarket. Good morning, gentlemen.
Good morning.
Good morning.
Tell us how this initiative is really trying to help the neediest in the Syracuse area when it comes to health and wellness.
Well, this initiative really is a partnership between organizations that are committed and have been involved in trying to improve the health of people in this part of town. Paul, No Jane, the No Jane grocery store has been a long-standing foundation in this community. St. Joseph's Hospital has the West Side Health Center right across the parking lot from the grocery store. And the Lerner Center is a research center focused on helping bring partnerships together. So we're really working in a partnership mode to bring information to people who live here, to bring information about nutrition, healthy lifestyles, linking medical care to nutrition. Partnerships really are the foundation to this.
If I could turn to Paul. Hi, Paul. This is Chris. I'd like to ask you a question on why you're participating, why you feel it's important to keep the neighborhood up and improve the neighborhood.
You know, Chris, thanks for asking that question. It's important. I think I just lost you. Live TV, that's what happens. Yeah. And Chris, by the way, the weather's your fault today, isn't it?
Yes.
I think it's important that we recognize that access to food was the key component that brought society together 12,000 years ago. And it's just as important today as it was then. You know, it's the creation of the marketplace. Every part of our lives involve access to food, whether it's a birthday, whether it's the need for nutrition, whether it's a holiday. And so these neighborhoods in inner cities have suffered. They've lost that. And when they've lost access to nutrition, they've also lost a key component to our societal values.
Part of this initiative is a listening tour that you're going to be doing. So you're not just telling people what to do, you're also listening to their concerns and their needs. Tell me where this tour is going to stop along the way.
We're absolutely not telling people what to do. We're asking people what would help them do what they would like to do. The store really is a location where people can access nutrition. What we would like to add is a dimension of education and a dimension of support to help people make the right choices around nutrition and link their choices with nutrition to the medical care that they can receive at the West Side Health Center. So it's the bridging of what people want, what is available here at No Jane's grocery store, what health care is available at the West Side Health Center, and it's the glue to bring those pieces together that we're focused on.
Hey, Tom, Paul, I'll ask this question for both of you. I'm not sure which one is best suited to answer, but how do you quantify, how do you measure progress with a program like this? Is it something that you see over the years? Is it any thoughts on that?
Yeah, I think the first thing that we have to recognize is we have good data on what type of products we move now. And so our goal, by example, should be, what's our bread category? How much of that is sold as white enriched flour products versus whole grain? Well, over time, we hope to see an inversion of that category. Same could be said about milk. You know, how much is sold as whole milk versus 1% or skim? You know, we're going to take the data we have now and we're going to implement programs to start changing those type of behaviors and ultimately, hopefully, health disparities improve.
Well, thank you both for joining us this morning. Hey, real quick, what did you say?
Just to follow up on Paul's point about data, we're putting in a data system that will help us track outcomes over time in terms of biometric markers, body mass index, blood pressure, and that sort of thing.
Wow. Well, it's a great thing you're doing there on the West Side. Thanks so much, guys, for your time, and please keep up the good work. All right, coming up next time.